Based on data available this week, this season is now classified as a high-severity flu season overall and for all age groups for the first time since 2018. Of the 4,214 viruses reported by public health laboratories, 4,079 were influenza A and 135 were influenza B. So with this in mind, I would like us to play a little true or false game, and I'm hoping that our little ones can join us from back there, and maybe the parents can help them guess if they need help. All right, so the who can beat the flu game. You ready? To contract the flu, I need to be exposed to someone's blood or bodily fluids. Is this true or false? False. All right, false. The flu virus is primarily spread through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can be inhaled directly by people nearby or land on surfaces such as doorknobs, countertops, or desks. Oh, no, that was the explanation for the, yeah, it's true, that's true. All right, what about this one? Children have very good hand hygiene habits. All right. Right, that's false. The Centers for Disease Control and Prevention, CDC, notes that children, especially those under 5 years old, are at higher risk for severe flu-related complications and can spread the flu to others more easily due to hygiene habits not being fully developed. That makes sense, right? They're just learning when to wash their hands, how, and all that stuff. How about this one? I should avoid shaking hands with an infant or a child. You're not sure? Okay, let's see. It's true. A handshake can transfer a substantially higher amount of bacteria compared to other forms of greeting like fist bumps, smiles, and hugs, essentially making it a major vector for transmitting pathogens between individuals. What about this one? The number one way of preventing illness is proper hand washing with soap and water. Is that true or false? All right. It is true. You're right. According to the Mayo Clinic, hand washing is one of the easiest and best ways to protect yourself from germs and most infections. Wash your hands with soap and water for at least 20 seconds. Wash your hands before making or eating food, after coughing or sneezing. If you cough in your hands, which you should be coughing like this, right? But if you do in your hands, wash your hands. After shaking hands, using doorknobs, and after using the toilet. Use hand sanitizer when appropriate. All right, what about this question? I should avoid touching my face with my hands as much as possible. True. Nice, Melanie. Good. Pathogens or infectious agents can be picked up by our hands and get into the body through mucous membranes on the face, like through our eyes, nose, and mouth, and even our ears, carrying these pathogens to our throat and lungs. What about this one? If I suspect I have been in contact with someone who is sick, I can use garlic to help strengthen my immune system and fight off potential illnesses. True or false? Right. True. You're so smart. Garlic contains compounds that help the immune system fight germs. Whole garlic contains a compound called allicin. When garlic is crushed or chewed, this compound turns into allicin, the main active ingredient in garlic. This compound has been shown to boost the disease-fighting response of some types of white blood cells in the body when they encounter viruses, such as the virus that causes the common cold and the flu. And I should say that this works best when you first start to feel like you may have something coming. That works best, just drown yourself with garlic. What about this one? If you suspect you are getting sick, drink 4 8-ounce cups of water in 1 hour to help flush out illnesses. Is that true or false? Let's see. True. Dr. Middle from the UC Pine Life South Center suggests that drinking 4 8-ounce cups of water in 1 hour at the first signs of symptoms can help the body prevent the onset of symptoms associated with cold and flu viruses. Again, at the first signs of symptoms, when you're feeling that you have something going on in your throat or your nose is feeling kind of different, this is a good idea. Deep breathing throughout the day has nothing to do with fighting off illnesses. Very good, false. Deep breathing ensures that your lungs get a good supply of oxygen, which can help improve circulation, promote better respiratory function, and strengthen your body's overall resilience. Anxious thoughts can lower the immune system. Yes. When someone experiences anxiety, their body releases stress hormones like cortisol, which can suppress the immune response, making them more susceptible to illnesses and infections. So, no matter what we do in this world, even if we're eating all our carrots, if we're doing everything, or we think we're doing everything right, eventually we're going to get sick, right? But thank God, he reminds us in Isaiah 41:10 that he is the one who strengthens us. He is the one that helps us and upholds us with his righteous hand. So we don't need to be afraid of being sick, but we need to do our part to don't get unnecessarily sick.